Good evening. My name is Adam Petway. I'm currently the Director of Athletic Performance for the Washington Wizards. I'm also a PhD student here at UCAM. Tonight I will be discussing kinematic factors involved with general exercise selection. In basketball or any sport, it's very important to have a neuromuscular test and assessment to guide and dictate your programming variables in the weight room for ultimate success on the court. For us, we use a myriad of different tests on a force platform, but our primary test that we use is a counter movement jump, a squat jump, and a depth jump from a standardized height. That standardized height is typically 18 inches. We feel like 18 inches is a good baseline for our basketball athletes relative to an elite population because it will not exceed their vertical jump capabilities. When we look for our depth jumping capabilities, we're typically looking for how the joint action sequence from proximal to distal, going from foot to ankle, ankle to knee, knee to hip, and hip to trunk. This interplay of kinematic sequencing is very important in increasing athletic performance on the court and reducing the potential risk of injury. Starting at the foot and ankle, ground reaction forces should be dissipated from distal to proximal and then reapplied vertically in the z-axis in a projection of the center of mass going up. So when we look at the foot going off the box, we want to see a nice dorsiflexed ankle with a whole foot landing, amortization occurring around the zero velocity point, the transfer of force from foot into ankle, ankle to knee without any kind of medial or lateral collapsing, knee to hip without any kind of anterior shearing of the pelvis or any kind of internal external or right to left rotations, and then pelvis to trunk. The primary aberrance in the mechanics that we see upon ground contact to the trunk is an excessive flexion. Now, based on whatever aberrances we see upon ground contact, we can identify potential general exercise selections to apply to each athlete. General exercise selections are low CNS in nature and are opposite of our high CNS menu items. Our high CNS menu items are an acute stimulus applied to the athlete for a desired adaptation. This includes very centrally located adaptations such as high threshold motor unit recruitment, rate coding, Henneman size principle, and synchronization of motor unit recruitment. So clearly these adaptations from a high CNS menu item are very centrally located. Now, going to our general menu items. General menu items are low CNS in nature and are global, typically three-dimensional. So using our assessment of a depth jump, we can apply either aberrances at the foot and ankle, knee, hip, or trunk to specifically address aberrances with a general exercise selection. And we feel, from an athletic performance standpoint, that the depth jump from an 18-inch box is the best tool to use in these methods. Again, my name is Adam Petway. I'm the Director of Athletic Performance for the Washington Wizards. I'm also a PhD student here at UCAM, and I'm glad I had this opportunity for 3 minutes to talk to you about general exercise selections and the kinematic factors involved with general exercise selection.